Hi, I'm Dr. Akanksha, and today let us talk about vitamin C and sensitive skin. So vitamin C is a very popular skincare ingredient. It is an antioxidant. It brightens skin, reduces hyperpigmentation and dark spots, reduces fine lines, evens out skin tone, but sometimes it might cause redness and irritation to sensitive skin. Which form of vitamin C can you use for sensitive skin? The active form of vitamin C, that is L-ascorbic acid, is sometimes little strong for the sensitive skin. It might just cause redness or irritation. You can use the esters like tetrahexyl decyl ascorbate, sodium ascorbyl phosphate, magnesium ascorbyl phosphate. What percentage of vitamin C should you use for sensitive skin? Always start with a low percentage, something like 5 to 10%, and then gradually increase. Start by using twice a week, then increase it to alternate days, and then daily usage if your skin tolerates it. What can you pair your vitamin C with? You can pair it with hyaluronic acid, ferulic acid, vitamin E, green tea extract. What should you not pair your vitamin C with? Do not pair it with retinoids, with benzoyl peroxide, and with the strong exfoliating acids like alpha hydroxy acids or beta hydroxy acids. See that while you're buying your vitamin C serum, it should always be in an opaque airtight pump. Conditions in which you should not be using vitamin C: if you have active acne, red, irritated or inflamed skin, or skin with rash, then do not use vitamin C. You must treat these conditions first and then start using vitamin C.